Yes, hi everyone. Good afternoon again. So, yeah, I can see 100 plus people are there now. Almost we are okay, 14:05. So it's 2:05. So let's start the class. So this is the induction class and the orientation program for this course, pharmacist in emergency medicine. Right, guys? So I welcome you all. You won't believe, but there are around 500 plus registrations right now, 500 plus participants who have joined this course, and they'll be joining the entire uh, course, this 12-week course of emergency medicine, right? And let me tell you, there are 12 modules, and there are multiple people, many people from India and abroad who will be taking your classes on different modules, on different things. And let me share the brochure with you. I think you guys have gone through the brochure, but let me tell you what is there in the brochure, what we are going to cover, and what extra I have added after this course. After starting this course also, I have added multiple things for you, right, guys? So this is the pharmacist in emergency medicine, the 12-week basic certificate course, starting today. So usually, as you must have seen the last pages, I'll show you this course, the classes will be on Tuesday and Wednesday. Okay, as we have given the instructions in the browser, the classes will be on Tuesday and Wednesday. So as here, I think I've written here. So classes are every Tuesday and Wednesday, 7:30 p.m., 7 p.m. to 8:15 p.m. But right now, as we were discussing in the group and with all of you, so we got the things that in Karnataka, Kerala, and Andhra Pradesh and Telangana, multiple universities are conducting the exams in November, right? Rajiv Gandhi Health Science University is conducting the exams right now, and I think they are starting the exams from 2nd of the November. Okay, and those exams will go on up to 18th November, and then in between again Kakatiya University and Osmania University and Kerala Health Science University also, they have the exams for pharmacy people. So it will be quite tough for all of us to align with the classes every week, at least two classes. So what I have decided and my team has decided is we will be we will be conducting the classes only one day in a week right now. Okay, until your exams are finishing. Okay, till your exams are going on, we will conduct only one class. So it will not be a big burden on all of us and all of you who are attending the classes, and majority of the people are from these states. And December, again, I just got a call from the principal of 2 3 universities from North India also, who are collaborated with us. They also have the exams in December, right? So but we'll see as I told in the group also yesterday, we keep the window. See, 12 classes, 12 weeks. So usually what we do is we complete the course within the time, right? And still we will complete the course within time if we are conducting only one class every week. And it's not like for all 3 months, but until till your exams are going on, we'll just conduct one class every week, and that will be on Wednesday. Okay, most probably in the Wednesday. And if we'll be asking, because this course is very critical and I don't want anyone to leave the classes or anyone to miss the classes, so I'll be seeing if I can conduct the classes on Sundays. Okay, I'll ask my people if they can conduct the classes on Sundays in exceptional cases, not every week, but in exceptional cases when you all have the exam. So I'll try to get these courses, get these classes done on Sundays, okay, where everyone can come and attend, right, guys? So it is like for your convenience only I'm doing, right? So but don't worry, we'll be completing this course within 3 months, and your classes we will be conducting at your convenience. And along with that, let me discuss the syllabus a bit with you. Then we'll be, talking to you. And I have many things to discuss with you. I have to take some class also for you today. Okay, not only discussing the syllabus, what we are going to do, and what are the exam patterns and all, but I have to discuss the class also. Okay, I have prepared some slides also for you, right, guys? So the syllabus, as you can see, must have seen medical management. So what are the correct administration of medications during the emergencies? What are the emergency medications? What are the emergency examinations? Those everything will be studied in this, and we'll be discuss those things, including proper dosing and proper drug interactions, contraindications, and how to prepare the emergency medications like epinephrine, naloxone, anticoagulants, and all. Right. So these all things will be discussed, and then again medication availability and storage, because you guys are not only PharmD, but I have many, not many only, but 100 plus D-Pharm students from various colleges. Is my voice low, guys? Am I not audible? Somebody's writing that my voice is low. Am I not audible, guys? Okay. Okay. Thank you, guys. Thank you. So the medication availability, that is very important topic when we are talking about the pharmacist in emergency course, emergency medicine. So we have to take care of the things like what are the availability of the medications, right? And how to store the emergency medications, because most of the emergency medications are injections, right? So we have to maintain the cold chain for those things. So multiple things are there, that will be discussed in medication availability and storage in the emergency department, right? And then clinical decision support. So clinical pharmacist and pharmacist are one of the major key, I'll say the key stakeholders in the emergency medicine, right? And they are the key decision support or key decision makers with clinicians and the patients, how to go ahead with the further tests, further investigations, and further treatment part, right? Like maybe some patient has come up with a heart attack, like what kind of stunts they have to put, if they want to go for the stunt, if they have the financial support, if they don't have the financial support, multiple things. So emergency medicine is not only the thing of using the drugs, or naloxone or index, epinephrine, atropine, and all, but this is a big deal to make the clinical decisions, okay, where pharmacists are the major stakeholders, right? So you will be learning all these from this course, right, guys? And then along with that, toxicity and toxicology, poisoning, what are the toxic components, how the how you get the patients with the toxicities and poisonings, right? So we'll be discussing, I'll take this part, and I'll be taking taking you all through the cases, okay, real time cases I'll be taking you through, and we'll be discussing their treatment strategies and their antidotes and everything, okay? Then BLS and ACLS, which are major components of not only the emergency medications or emergency medicine, but it is the emergency everywhere, okay? If you know the basic life support, or acute cardiac life support, it is useful everywhere. If you are in somewhere in the train, plane, or maybe you are in the public events, or you are going on the road, or you are in the railway station, bus station, anywhere, you can get some kind of emergency, people with heart attack, people with stroke, people with multiple comorbidities, and people with accidents. So you need BLS and ACLS knowledge to help the people with cardiac arrest and other emergencies. So that will be taken care by us. We will be teaching you the BLS and ACLS at least, so you can learn those things and you can apply those things in the practical scenarios, right? And then drug allergies, very important. After giving the drugs, there are multiple allergy emergencies and adverse event. So for that, people come and get admitted to the hospital, right? So those will be also discussed. And then drug interactions, contraindications are there, along with that medication management, as I was telling. And then emergency medications, I think I came back to the first slide. Wait. Yeah. So along with that, the medication reconciliations, okay, where we'll be telling about the accurate medication histories and reconciliation medications in the transition of care, okay? And then the patient specific considerations, like how to adjust the medications and dose of the medication, based on the age, weight, medical history, and allergies. How to not giving the correct medicines, or maybe sometimes giving the alternate medicines in such cases where we have the specific considerations for the specific patients, right? And then training, communications, and collaborations, because teamwork is very important for emergency medicine, right? Emergency medicine is not a single person work, or not a one person work. It is a teamwork. So you have to learn like what are the trainings we need to work, what are the collaborations, what are the references, what are the team members we need in the emergency care, and how to communicate properly, being a pharmacist, being a nurse, being a doctor, how to communicate, how to collaborate with the people, and give the emergency care to the patients. And major part is how to document and report the event, and if something happens related to the drug availability and all. So these things will be taught in this, and along with that there will be multiple workshops like CPR workshop, medical emergencies workshop, and along with that I have added multiple chapters related to the multiple cases. Okay, cases means like how to treat the emergency nephrology case. Okay, nephrology department, emergency, if someone comes with the CKD or AKI, right? If someone comes with the MI, or the myocardial infarction or heart failure exacerbation, so how to treat them. So I have added some more classes. So now not only 12 classes, but you will be learning around 15 to 16 classes. Okay, guys, 15 to 16 classes for you. I have created more classes in that, because I don't want you to be just understand whatever written in the syllabus that we are delivering, definitely. But I want to complete the at least basics of the emergency medicine, along with certain specific diseases, like to understand and cover those in the emergency care. Okay, for all of you, right, guys? So along with that, now I'll come to the slides. I'll share the slides. Slides are not something the matter, but there are questions for all of you. I want to know my audience, what is my audience, and how they are doing, and what are what they want to learn from us in that matter. So that is very important, right? So let me share the slides, guys. Okay, and then you can ask your questions also, and I'll be talking about the questions and all. So just let me share. Yes, please confirm, guys, please confirm if you are able to see the slides, everyone. And please stop your videos. Audios are off from my team, so please off your videos as well, guys, please. Okay, I hope it is visible to all of you, and I'm clearly audible to all of you. If not, please let me know. Okay, yes, perfect. So I welcome you all again to the Pharmacist in Emergency Medicine course. And today's webinar, today's class or session is on orientation program and understanding the PEM, Pharmacist in Emergency Medicine. Okay, PEM is Pharmacist in Emergency Medicine. So let me ask you some questions, and let me know what exactly you think about those, what are your answers, and then I'll be discussing with the explanations. Okay, but before that I want to know my audience. So guys, what are you studying right now, or whatever you have studied? Okay, please mention in the chat box if you are diploma in pharmacy, if you are bachelor of pharmacy, if you are doctor of pharmacy, if you are master of pharmacy, if you are other, okay, from nursing or any department, any other departments. Okay, okay, yes, guys. Okay, perfect. So majority of the people are PharmD and DPharm, right? PharmD and DPharm. DPharm, I know because there are two colleges who have associated exclusively to teach their DPharm students. Two colleges from North India. They are with us. I welcome few people from the Sri Sai College of Pharmacy, Pathankot, and another college in Chandigarh, and another college in Hoshiarpur. Guys, I welcome you all to this course, and don't worry, it is very basic. अगर आपको कुछ समझ में नहीं आ रहा है तो आप बीच में भी मुझे रोक के पूछ सकते हैं, right, guys? कोई प्रॉब्लम नहीं है, हिंदी में, इंग्लिश में, वी आर गुड इन ऑल द लैंग्वेजेस. ओके, अगर तुमको कुछ समझ नहीं आ रहा है, पीपल फ्रॉम द डी फार्म, so you can just stop me and ask in between. Okay, there is no language barrier in my class, so you can ask in Hindi, English, anything. Okay, guys, तो ठीक है, let's start with that. I think most of the you people have answered, no worries at all. So PharmD, BPharm, and diploma in pharmacy, yes, perfectly fine. And this course is perfectly designed for all of you. It is not only for the PharmDs, not only for the BPharms, not only for the diploma of pharmacy. Yes, definitely this is for all. Okay, and everyone from the basics to almost advanced version, intermediate levels of emergency medicine, we will be covering in that in next 15 to 16 classes. Okay guys, so this is done. Now I would like to know from you very some important questions. How much do you know about emergency medicine? Guys, you can just tell me. I'll just write how much do you know. Okay, what is your how much do you, I mean, that I definitely come to know in the next questions, but I'll just ask you, how much do you know about emergency medicine? Okay, so you just write here if you are beginner, if you are intermediate, having the intermediate knowledge, if you are having the expertise knowledge of emergency medicine. Okay, so just write B, I, or E in the chat section so I can understand what exactly I'm dealing with. Okay, B. Okay, very nice. B. 98% is B. Okay. Okay. Perfectly fine. Perfectly fine. No worries. Great. Yes. Okay. Beginners. Okay. Now let's go ahead with the questions. And I would definitely like to know from you, how much do you know? And I'll be telling you the answers as well. I'll be telling you the answers along with the questions. But first, I would like to know from you the questions. And then in the next slide, I'll be sharing the answers also. So first question here is, guys, I have taken 10, 11 questions, and all the questions are from different sections of emergency medicine, not only the one section but different sections of the emergency medicine. Okay, so can someone tell me what does the C stands for in the ABCDE of emergency care? Okay, ABCDE is the approach for emergency care. So what does the C stands for? Circulation. Okay, circulation. Can someone write the full form of ABCDE here? Can you write the full form of A, B, C, D, E here? Okay, A, B, C, D, E. Okay, C we got here, that is circulation. So circulation is what, guys? C for circulation. Okay, airway, breathing, circulation. Then D is for what? D is for, oh, come on. D, people are talking about the different parts. D, somebody is telling depression, somebody is telling disability, somebody is telling decontamination. Oh, guys, come on. बताइए डी फार्म वाले लोग भी. Or somebody is telling detoxification. Really? Can someone tell me the correct word? No distribution. This is not ADME. Oh no, this is not distribution. D for distribution is in the metabolism. ADME. Absorption, distribution, metabolism, and elimination. That is different part. What is ABCDE in the? Yes, guys. Yes, please tell me what is the ABCDE. Okay, what is the ABCDE in emergency medicine? Yes, please tell me. Yes. Okay. See, I'll write for all of you. A is for the, oh, I put my specs on. Okay. So A is for airway. B for breathing. Okay. B for breathing. C for circulation. And D for what? Disability. Disability. Okay. And E for exposure. So what exactly does it mean? See, the class has started. The emergency medicine class has started here already. See, when there is some emergency, first of all, you have to clear the airway. Okay, you have to make the proper airway. Oh, I'm so sorry. Yeah, that circulation is the answer, no worries. So we have to make the proper airway, or make or create the proper airway to the patient wherever, whether it is in the public, where it is in the anywhere in the flight or anywhere. You must have seen wherever the injury happens, or wherever the people faint out, or where the people get the cardiac arrest or heart attack, what usually happens is the entire crowd come and they cover the patient, right? Just to see, just to make videos or whatever, but they cover the patient, right? But that is not the right way. They are blocking the airway, they are blocking the oxygen. Okay, they are, because in that situation people are in the need of oxygen. उनको ऑक्सीजन की जरूरत है उस वक्त पे बहुत ज्यादा। तो हमें whenever somebody is in emergency, हमको सबसे पहले एयरवे क्लियर करना है, right? We have to create or make the airway. We have to remove the crowd from surrounding. We have to create some kind of if you have some specific things to things for the air, you can use. Otherwise, just make the environment clear, remove the crowd out of the patient, and then keep the patient somewhere where there is a fresh air, okay? Or maybe there's a little higher source of the air. So we have to make the proper airway. This is when you get the emergency medicine anywhere, right? And if there are usually cervical spine injuries, then we have to make the airway by putting the patient into certain positions, okay? Like maybe lying down, or if the patient is getting the good airway, if they are breathing nicely by standing or lying down, or on supine position, or back position, do that. I mean, according to the conditions, there are different positions. So जिस position में भी patient को अच्छी सांस आ रही है, हमको उसमें उसको रखना है। Understand? So A belongs to the airway. A stands for the airway. B means based on the airway, we have to see how difficult the person is taking the breath. Okay, how difficult is the breathing? So we have to understand that about the patient. If the patient is not breathing at all, if the patient is in difficulty of shortness of breath are there, or kind of apnea, or if the breathing is too much, or breathing is very low, so we have to find out what kind of breathing is that, and then we have to make it available by maybe putting the NIV or whatever is the available that time. Okay, and if you have the instruments to create that, then use them. Okay, and immediately arrange those things. Arranging the breathing, like to remove that breathing difficulties, or to alleviate the symptoms of breathing difficulty, right? Any kind of respiratory system you have to arrange at that time, right? And then circulation. So what exactly the circulation is? We have to look at the blood pressure, we have to look at the circulation system, vitals. We have to look at the vitals. How much is the heart rate, how much is the blood pressure? If it is possible, look at those and then decide what to do. Then the disability. If the patient got some disability, maybe the hand breakage, or maybe the hand fracture, leg fracture, so check the physical, that is called as physical checkup, first survey. Okay, there are two surveys, primary survey and emergency surveys in the emergency medicine. Okay, so in the primary survey, we have to look at the patient's body, if they got any kind of disabilities. Disabilities not only the fractures, or tissue injury or muscle injuries, but fractures comes this disability comes with the, if they are going into the coma, or they are unconscious, or they are having the slurred speech, multiple other things are there. Okay, so those all things comes under the disability. But then disabilities are also two types. One is permanent disability, one is temporary disability. So you have to find out what kind of disability the patient has right now in the emergency situation. Okay, guys, and then we have the exposure. So we have to always look into the exposure. Like again, the primary determination. Okay, primary determination of primary survey, look at the entire body. If suppose snake bite is there, okay, so look at the exposure if the patient has the snake bite marks. Okay, if suppose electroculated the patient, so look at if somewhere it is the burn. Okay, if the patient is the case of burning, then look at the burns in the body, right? So you have to look for the exposure. So E stands for the exposure. Okay, E stands for the exposure, right, guys? So we have to that's how the A B C D has been created for the emergency, and this all comes under the primary survey. Let me write that all comes under the primary survey, right? This all comes under the primary survey. Okay, primary survey. So we have to take care of these things, these 5 things, when someone comes to the emergency or you get the emergency situation with the patients. Okay, guys. So your question, your answer was circulation. Circulation is perfectly correct. Circulation is the correct answer. Now, question number 2 for all of you is, which of the following common symptom of the heart attack? Which of the following is a common symptom of heart attack? Tell me, guys. Yes. SOB. SOB. Yes, absolutely. So shortness of breath, because this is the, see, guys, when we talk about heart attack, what is the typical symptom of heart attack? Can someone tell me what is the typical symptom of heart attack? Typical symptom of heart attack. Diaphoresis, chest pain. Yes, typical symptom of heart failure is nothing but chest pain. Okay, but here why I did not keep the chest pain? मैंने chest pain क्यों नहीं रखा यहाँ पे? क्योंकि चेस्ट पेन एक इतना कॉमन सिम्टम है कि उससे डायरेक्टली यू विल टेल कि भाई और कुछ नहीं है, इसमें सिर्फ चेस्ट पेन है. आंसर इज चेस्ट पेन. बट यहाँ पे यू हैव टू फाइंड आउट द करेक्ट आंसर, बेस्ट करेक्ट आंसर. तो अभी अगर सीजर पे बात करेंगे, सीजर इज नॉट द करेक्ट आंसर, राइट? नॉट एट ऑल एसोसिएटेड विद द हार्ट अटैक. अगर हम एक्सेसिव थर्स्ट की बात करेंगे तो वो भी हार्ट अटैक से रिलेटेड नहीं है. दैट इज एसोसिएटेड विद डायबिटीज यूजुअली. ओके, अगर हम ब्लड विजन की बात करेंगे so that is also not related to heart attack directly, but yes, in some cases of syncope you can find the blood vision, but not everywhere. So the best answer for this is SOB, right? This is the perfect answer for heart attack symptoms, right, guys? You understand, right? So this is number 2 questions, and answer here is shortness of breath. So question number 3 for all of you is here. In emergency medicine, what does GCS stands for? General cardiac screening, Glasgow Coma Scale, global clinical symmetry, gross cardiovascular status. You guys have to tell me. Yes, बताइए GCS क्या होता है emergency medicine में? Yes, बताइए सब. GCS, everyone is almost right here. GCS stands for Glasgow Coma Scale. Okay, Glasgow. So I'll come to that. Glasgow Coma Scale is the correct answer. So now tell me, what is Glasgow Coma Scale and why do we use Glasgow Coma Scale? What is the importance? What is the application of Glasgow Coma Scale? So what is the importance and application of Glasgow Coma Scale, guys? To assess the level of consciousness, neurological examination. That is the neurological examination to understand the patient's orientation. Okay, this is the neurological examination, usually, to understand the patient's orientation. This is for the orientation, okay, orientation means how awake the patient is. Okay, how alert the patient is. Okay, how awake the patient is and how alert the patient is. So from the Glasgow Coma Scale, there is the proper scale. We get to know how awake and how oriented the patient is, right, guys? So that's how we and where we use the Glasgow Coma Scale, right, guys? EVM score is different also, yes, but there are multiple scores, not only Glasgow Coma Scale. There are multiple scores, but WHO uses, there is WHO score also. There is WHO score also, there is Glasgow Coma Scale also. Multiple scores are being used, but majorly and widely GCS score is being used for that, right? Number question 4. Which healthcare professional is typically the first point of contact for a patient in the emergency department? Teamwork. This is the question of teamwork. This is the, sorry, oh, I saw the answer. My bad. My bad, guys. If you are thinking it's a pharmacist, not at all, it's nurse. Okay, it is nurse. So this is the teamwork, right? Why? Yeah, team of emergency. Team of emergency medicine. Okay, so what are the components of team of emergency? First, like I'm not talking about the point of contact, but I'm talking about first, if I write, that is clinician. Okay, then nurse, right? Then clinician are also specific. There are emergency medicine specialist, EMSs. Okay, emergency medicine specialist. And then third, if we say after nurse, there are radiologists, because radiologists are needed at that time to understand the actual scenario, neurological behavior and neurological injuries, or maybe the fractures or whatever. Radiologists are much needed in that. And then the surgeons on standby, right? And then definitely not at the fifth number, but the pharmacist to choose the correct medicine. Okay, and then what else are the team members? Who else is the team member of emergency medicine, guys? Tell me, who else is the major team member or the primary stakeholder in the emergency medicine? बताइए. Yes, कौन कौन होते हैं emergency टीम में? Yes. Okay. सो जो ये लोग हैं, ये लोग बहुत इंपॉर्टेंट लोग हैं. ये लोग ज्यादा मतलब 5 लोग जो है ये इंपॉर्टेंट होते हैं इमरजेंसी टीम में, बिकॉज दे हैव टू टैकल द थिंग्स. एंड वन मोर इम्पोर्टेंट पार्ट ऑफ द emergency medicine is one more important part of the emergency medicine is anesthesiologist. Okay, anesthesiologist. Anesthesiologist. Okay, this is also the part of emergency team, anesthesiologist. Okay, so this is the teamwork, and we have to collaborate with each and every one of them. They should be on the toe in the emergency department. Okay, now the question number 5 is, what is the purpose of RICE protocol in treating the musculoskeletal injuries? What is the purpose of RICE protocol? I mean, what exactly the RICE protocol is? Can someone tell me what exactly the RICE protocol is? And why do we use? In the musculoskeletal injuries, people comes with, if the person, suppose I'll write here, what are the indications for RICE protocol? What are the indications for RICE protocol in the emergency, guys? See. Okay. Yeah. What are the indications for RICE protocol? Indications for RICE protocol. Right? RICE protocol. Number 1, fall. Number 2, RTAs. Okay, so fall of anything. And number 3, any other accidents. Right? Majority RICE protocols are being used in the accidents or in case of fall. Right? If the patient has fall. So RICE is to check the musculoskeletal injuries. If the muscles are injured or there is any kind of fracture in the bones, those multiple things, those things will be checked in the RICE protocol, and we have to settle the injury with RICE protocol. We have to settle the injury with RICE protocol. So the correct answer here is what? Rest, immobilize, hold, and elevate. Okay, immobilize, hold, and elevate. So what does it mean by rest? Whenever there is an injury, first make it rest for some time, not immediately rush to the hospital or someone. First rest and then immobilize. Immobilize means what? Immobilize means then start mobilize the things, and then stay in the rest for some time, keep it cold, and then start elevating the things. Okay, then start moving the things exactly the part is. Okay, elevate is not exactly the moving, but elevate means the injured part must be above the body, a little above the body. Okay, right, guys? Little above the body. So we have to keep it above the level of body. Okay, that is the elevate part in the RISE protocol. We'll be talking about the RISE protocol in the upcoming classes also. Okay, and then, oh God, wow, which of the following is the common sign of anaphylaxis reactions? Yes, yes, which is the common sign of. No, I got that. I got that. That I told you the answer. I showed you the answer. Right. I showed you the answer. Wheezing and difficulty in breathing. But I'll change my question here. Tell me, what are the anaphylaxis reactions and how does it happen? कैसे होते हैं anaphylactic reactions? क्यों होते हैं anaphylactic reactions? Tell me. Answer is wheezing and difficulty breathing. Okay. So you have to tell me why the anaphylactic reactions happen. Okay. And what's the reason behind that? Type 2 hypersensitivity reaction, perfectly fine. Allergies, these are allergies. And rashes, allergies, allergic reactions, exposure to certain kind of allergens. Okay, allergens, only allergens. Yes, so there could be, yes, there could be indications, or I can say the causes. One is allergens. Okay, number two, drugs. Number three, can someone tell me what else? What else? Guys, number three is very important. Everyone's life. Okay. Food, isn't it? Food, food. Yes. Breathe up. Someone is bizarre. Okay. Food. Okay. Food. See, someone has mushroom allergies. Okay. Someone has fish allergies, fish oil allergies. Someone, the different allergies are there. Okay. Sting bites are there. Sting bites, definitely sting bite is there. Seafood allergies are there. Preservation allergies are there. Preservatives allergy. So yeah, in the foods, multiple type of things. Seafood and stings. Yes, definitely. I think my pen is not working. Yes, sting bites. So these things can lead you to anaphylactic reactions, and there are not only the wheezing and difficulty in breathing. There are multiple other symptoms. Okay, multiple other symptoms for the anaphylactic reactions like allergies, hypersensitivity, wheezing difficulty, and rashes on the body. Multiple things are there. Okay. Question number 7 here for you is local you. Question number 7 here for you is, what is the recommended first aid treatment for a severe burn injury? Yes, guys, severe burn injury. Tell me. Yes, guys. 4. Remove any cloth stuck to the burn. My question here is, I hope you understood that, but you have to but you have to choose the best correct answer or most correct answer. Okay, maybe here there are one two three correct answers. I mean, not one two three, I mean maybe one or two or three correct answers. Okay, but you have to choose the most correct answer, guys. What is the most correct answer here? Most correct answer is number 2. Cover the burn with a sterile and non-sticky bandage. Okay, whenever someone comes with the burn, like बर्न के साथ कोई भी आता है तो उसको हमें बर्न्स को कवर करना चाहिए स्टेराइल और नॉन स्टिकी बैंडेज से, राइट? And other C, number 4 is also the correct answer. Remove any clothing stuck to the burn. That is not exactly the primary concern, because if you are removing the cloth which is stuck to the burn, that can make more injuries, and that can remove the skin or the internal tissues, right? So that is not the correct answer perfectly. So the correct answer here is cover the burn with a sterile and non-stick bandage. Apply ice directly to the burn? Not at all, never. Okay, that is not that kind of burn. Like if you have the grade 3 or grade 4 burns, never apply the ice directly to the burn. Okay, immerse the burn in hot water? Not at all. It's not it is the perfectly wrong answer. Okay, so the correct answer here is cover the burn with a sterile non-sticky bandage. Okay, now my next question here for you is question number 8. Which of the following is not a component of initial assessment in trauma care? Yes, guys. So, assessment. Now we have come to the assessment part. Yes. 3 more questions. Not many. 3 more questions for all of you. Yes, perfectly fine. You know that. Because you know ABCD, so D is not the correct answer, right? Disability is not the correct answer. I mean, not the ABCD, sorry. Trauma care. This is not ABCD here. Okay, this is ABC only. This is up to ABC only. Okay, components of initial assessment is ABC only. So in ABC, there is no disability. Okay, number 4 is the correct answer. Yes, number 4 is the correct answer. Disability assessment is not a component of initial assessment of trauma care. Question number 3 here for you is this. Now you have to select one of the best answer out of 5, guys. In the context of emergency medicine, what does the term tries refer to? Yes, what does the term tries refer to? Yes, sorting out and prioritizing the patients based on the severity of their condition, or medical equipment, or a type of surgical procedure, a medication for pain relief, or the special room to treat the patients. Yes, guys, tries. What is tries called as? Yes, everyone. Okay, so tries is the procedure of prioritizing and sorting the patients based on their severity of the conditions, whether they should go to the emergency, whether they should go to the OPD outpatient ward, or they should go to the admission, or they should not get admitted. They should be just having some time in the daycare ward and go back home. So tries is kind of the procedure, okay, procedure of sorting and prioritizing the patients based on their severity, and then dividing them into the different, then sending them, or directing them to the different departments. Like if they are in emergency, send them to the emergency ward, emergency room, ER. If they are normal stable, send them to the OPD outpatient department. And if they want the immediate admission, send them to the admission. If they are like, okay, they came up with the fever and they can subside in 4 hours, 5 hours, you just give them the medicine and send back, then keep them in the daycare. They'll be admitted there for 3 hours, 5 hours, and then they can go back home. So tries is the procedure of prioritizing, sorting the patients based on the severity of their condition. Okay, guys, understand? So number 1 answer is the perfect correct answer, right? Question 10. What is the primary treatment? Now that's the treatment. I have included one question from the treatment part also. What is the primary treatment for a patient with suspected opioid overdose? Yes, number 3. Okay. Okay, yes. Correct answer is the antidote for the opioid poisoning is nothing but naloxone. Okay, there is no technical justification for everything, but naloxone, I'll tell you, naloxone is the antidote for opioid, right? Naloxone is the antidote for opioid. When we'll be discussing opioid overdose, I'll be telling you the MOA also, mechanism of action also, everything. Okay, so this is the correct answer, right, guys? Okay, and then yes. Now, question number 11 for you all is, which of the following is not a vital sign? Very simple question from the emergency medicine. If you are checking the vital sign, what is not the vital sign, guys? Skin color. Number 3. Okay. Number 3 is not a vital sign. Absolutely. Skin color is not a vital sign. Yes, absolutely. Skin color is not a vital sign. Vital sign means from the vital organs, we check the assessment in the primary assessment. So this is, one is blood pressure, one is respiratory rate, one is heart rate. Okay, but skin color is not at all the vital sign. So yes, perfectly right. You have answered these two questions amazingly. Okay, now a very important question for all of you is, and last slide, this is the last slide, and we'll wind up in next 2 to 3 minutes. You just have to write what are the roles and responsibilities of a pharmacist in emergency medicine. What are the roles and responsibilities of the pharmacist in the emergency medicine? Yes, guys, tell me. I'll write here. I'll write here emergency medicine pharmacist. Okay. Now tell me the roles and responsibilities. I'll write, around. Yes, people. Provide the correct medicine accordingly. Correct medication. Okay. Correct medication. Drugs, some incorrect drugs. Okay. Right medicine, right dose, right time. Factor of risk benefit ratio. Patient care. Okay. Correct medicine. Individualization. Okay. So I will write here the medication management. Medication management. Medication management means the correctness of medication. Okay. Correctness of drugs. Right. Drugs. Then rational use of medication. Yes. Then what else? Okay. Inventory and procurement. Right. Of medication. Okay. Yes. And then I told you very important part. What else is the thing? What else? Team efforts. Okay. Teamwork. I'll just write teamwork. Okay. Then next thing is, yes, medication management includes all of your like correct dose, correct time, correctness, and so the important part here, what I told you in the previous slides also, when I was going through the brochure, the important part here is the decision making for treatment. Okay, shared decision making, we call it shared decision making for the treatment. Okay, shared decision making for the treatment monitoring, proper dispensing of the medication. Yes, dose adjustment, inventory control. Yes, inventory control, dose adjustment, and side effect monitoring. Everything comes under the medication management. Okay, medication management, or we can say DUR, drug utilization review. Drug utilization review is the major work, one of the major work of pharmacist. Drug utilization review. Okay, drug utilization review. And you can tell the intervention, sometimes intervention, yes. And then patient counseling. Okay, patient and caregiver counseling. Okay, patient and caregiver counseling. Then what else? What else, guys? What else? No, electrolyte correction is not the work of pharmacist. Okay, so see, you might be thinking कि यहाँ पे जो है I have written multiple things, but what is the exactly clinical pharmacist job. See, DUR is the clinical pharmacist job, medication management is the clinical pharmacist job, decision making is the clinical pharmacist job. And if I talk about inventory procurement, along with that, B Farm and Farm D also do. Okay, Farm Ds and B Farm, D Farm and B Farms are also, helpful in the inventory procurement of the medications and decision makings. They might not be helping in the medication management or DUR. DUR is specific work for Farm Ds. Okay, DUR, decision making. I mean, other works also, but if I talk specifically, inventory procurement of the medication is the work of D Farm and B Farm also. Okay, and Farm D mainly focus on medication management or drug utilization review and decision making. And when again I come back to the D Farm people, they help in inventory procurement, along with that decision making, teamwork, and patient counseling. Similarly, B Farm also, Bachelor of Pharmacy also can be helpful in these matters. Like okay, one sec, guys. I'll just put the charger and come back. Yes, guys. Yes, I'm back. Yes. Okay, I just put the charger on laptop. Okay. Yes. So inventory procurement. What else you were telling, guys? What was the 10th question? Okay. What was the 10th question? Let me show you what was the 10th question. 10th question was, what is the primary treatment for a patient with a suspected opioid poisoning or opioid overdose? Naloxone. Naloxone is the dose, the drug which we give to the opioid poisoning. Okay. Okay, guys. So that's all for today. And your next class I'll be taking on Wednesday. And before Wednesday only, I'll be sharing the full what the full schedule of the classes. Or need according to your convenience will be changing the classes. That's okay, that doesn't matter, right? So I'll open the chat. Okay, I'll tell people, someone from my team can open the people to unmute. Yes, now you can unmute and ask the questions, guys, and you can talk to me also. Yeah. Sir, for this course, live attendance is necessary because I can't attend live classes, but I'll listen to the recorded sessions and completely 75 attendance. See, 75 percent attendance is important. Okay. And in very specific cases only, I will leverage the people from the live class. This is important for all of you to attend the live classes. Okay. Recordings are there for your convenience, definitely after the class, but try to attend the live classes because we are calling the people from outside. And see, that kind of interaction I want. That kind of interaction will help you learning the new topics and every topic whatever is there in the emergency medicine, because this is something new for everyone. Okay, this is something new for everyone and you must learn it, right, guys? Okay, so thank you very much, guys. Take care. If you have any questions, please ask me. Any questions? No. Okay, then take care, guys, and I'll see you. Thanks a lot. Thanks a lot. Thank you. Thank you. Thank you, everyone. Thank you. Take care. Take care, guys. Thank you. Thank you. Thank you.